This video is a rehabilitation plan for a grade 2 lateral ankle sprain. Ankle injuries are one of the most common sporting injuries, but are also most commonly left without proper rehab, which causes its high reoccurrence rate and often leads to chronic ankle instability. The expected time frame of recovery would typically be between 6 to 8 weeks. And this specific plan has been broken down into 3 phases: early, intermediate and advanced. Lateral ankle sprains affect the lateral compartment of the ankle and mostly the anterior talofibular ligament. Many lateral ankle sprains occur on landing or change of directions in sport that are non-contact, and happens when the foot is in plantar flexion, inversion with excessive pronation. However, before these 3 phases begin, and within the first 48 hours post-injury, things like rice and price can be applied to the ankle. This should help with pain management and to reduce swelling. The use of therapy modalities such as ultrasound, laser and soft tissue massage can also be used prior to beginning the rehab program. These can all help with pain management and help to reduce swelling around the site of the injury. Using these modalities can also help to speed up the recovery time and aid the healing process of the injured tissues. Alongside this rehab plan, the stages of soft tissue healing have been considered to optimise the process. During the early phase, the stages of soft tissue healing will be late inflammatory and early proliferation. The goal of the inflammatory phase is to stop the bleeding phase, which will happen before the early phase begins. This will happen through vasoconstriction, the depositing of fibrogen and clotting. This means the tissues are still weak, but pain-free work can be done, and increasing range of motion and helping prevent muscle atrophy is needed during this phase. The proliferation phase starts during the early phase but will continue into the beginning of the intermediate phase. This is when collagen is laid to produce scar tissue, which makes the injured tissue a lot stronger. For the majority of the inflammatory phase and the whole of the advanced phase, the tissues will be going through the remodeling phase, which is when the scar tissue becomes more functional and a lot stronger. And a lot more stress can be put through this tissue, meaning strengthening work, speed and rigidity can be worked on. Between each phase and before full return to sport, it should be a gradual progression throughout in order to stress the damaged tissues but not cause further harm to them. Each phase will state a criteria that needs to be met before they can progress on. The goal of the early phase of rehab for this injury is to have pain-free weight bearing and restore full range of movement. This is the criteria that needs to be met to be able to move on to the next phase. This phase can begin from 48 hours after the injury, and the sooner the better. The exercises of this phase progress from partial weight bearing up to full weight bearing by the end of the phase. As on screen, these tower exercises are really good for helping to increase range of motion and flexibility at the joint as they are working in all planes. They will also help to strengthen the muscles in the lower leg and the foot through no weight bearing, meaning it is manageable during this early phase and will start the strengthening process as soon as possible. The use of isometric exercises is beneficial in rehab, as when in a non-weight bearing stage, isometric exercises can be performed from a seated position. In the early stage of this ankle rehab, performing isometric exercises in plantar flexion, dorsiflexion, eversion and inversion will help to strengthen the muscles around the ankle and will help with increasing flexibility. The Hoover 360 is a modern piece of technology that has many functions, but in this case is used to help with increasing flexibility and mobility. It works through a moving platform that moves across all planes of motion and will help stretch the surrounding muscles of the ankle in this case. It will help to increase the range of motion at the ankle. The second phase is the intermediate phase. The goal of this phase is to increase strength at the joint through the surrounding muscles. During this phase, neuromuscular control will be developed, which is important in joint stability. It involves combined work of the central nervous system and muscular system, which results in a controlled movement at the joint. Proprioception will also be developed significantly in this phase, making sure of awareness of the body's position and movements. The exercises in this phase, as shown later, will progress from two-footed down to one-footed, and adding weights to strengthen the muscles. The progression criteria is to have full strength as prior to the injury and be able to jog pain-free. A lack of good proprioception can increase an individual's risk of injury and affect their joint's ability to function normally. Doing proprioception exercises will help increase joint stability during static and dynamic exercises. It also has many other benefits as seen on screen. Proprioception exercises will help with lateral ankle sprains, as it will help to stabilise the joint, improve balance and strengthen the surrounding tissues. Progressing from 2 feet to 1 foot is the next step of this rehab, as single leg exercises are important in ankle injuries and serve the purpose of strengthening the tendons and ligaments around the ankle. It also helps to improve balance and improve proprioception. These exercises can be progressed through closing your eyes, as it removes one of the sensors, and on unstable surfaces. Progressing onto 1 foot causes more control to be needed through that ankle, making it more unstable and harder to do. The use of single leg exercises are important in ankle injuries, as they serve the purpose of strengthening the tendons and ligaments around the ankle. It also helps to improve balance and improve proprioception. These exercises can be progressed through closing your eyes, as it removes one of the sensors, making it more difficult to stay stable. The single leg exercises are the most obvious progression on from double-footed, as it's taking away one point of contact, making it a lot more difficult on the ankle and puts a lot more stress through the joint. Squats and lunges are a compound exercise that work your glutes, quads and calves. They are a good exercise to develop lower leg strength, which is important in joint stability and helps to reduce the chance of re-injury. The final phase is the advanced phase. This is looking at returning to sport and making exercise more related to that sport. This video is looking at squash specifically, which as a sport involves a lot of change in direction, short, quick movements. Therefore, the exercises in this phase are going to look at building power, speed, change of direction and agility. By the end of this phase, you'll be able to return to sport, hopefully strong or stronger than before the injury occurred. Having good landing mechanics and deceleration is essential for the body to be able to cope with the high eccentric loads placed on the body during these movements. Having the ability to cope with these demands will help to reduce the chance of re-injury and will strengthen and stabilise all the joints involved. The use of plyometrics is an effective way of increasing power for sports that require quick, explosive movements. It involves exercises that use maximal force production in a very short duration. They also help to build speed, strength, and bone strength. It involves activities such as jumps, hops, bounds, or skips. Ladder drills are a multi-directional exercise. They help to improve agility and speed through complex footwork patterns, which are both key components in squash. They also will help with ankle stability by working the lateral ligaments, which in turn will strengthen them and help prevent re-injury. The difference between change of direction and agility is that change of direction is a whole body movement with a change in velocity or direction that is pre-planned, meaning prior to starting you knew the direction you were going to change at. However, agility is the change in velocity or direction in response to a stimulus. Therefore, agility relies on a cognitive decision before the change can happen. In squash, it is agility as you're waiting to see where the ball is going so you know which direction to go in. Therefore, throughout this plan, agility needs to be worked on. This exercise on screen is agility as I am waiting on a stimulus to know which cone I'm supposed to go to. This drill is very squash specific due to the movements I'm doing with lots of low lunges, getting close to the cone, pushing in and out. Throughout the rehab plan, it is important to keep up the conditioning of the rest of the body as to not lose strength anywhere else in the body. Maintaining cardiovascular fitness is also important and can be done throughout the programme. In the early phase, when full weight bearing isn't possible, exercises such as cycling on a static bike, rowing machines or swimming are great ways to maintain cardiovascular fitness throughout. To conclude this plan, there are 3 phases: early, intermediate and advanced, each with their own progression criteria which must be met before progressing on to the next phase. All activities should be completed pain-free in order not to damage the tissues further. This plan focuses on neuromuscular control, proprioception, strengthening, power and agility, which are all important components to being able to return back to sport and reduce your chance of re-injury.